So, hi everyone, this is Seema Rathore, Department of Pharmaceutics, COPS, DSU. So today we will be discussing about ophthalmic occuserts. So ophthalmic occuserts are also called as ophthalmic ocular inserts, and these are the preparations which are instilled into the ophthalmic region. So this is placed in the cul-de-sac region. So you will be wondering what is cul-de-sac? So if this is the eye region, if this is the eye, whatever the region is below this layer, we call it as cul-de-sac. So the ophthalmic inserts or occuserts, we place it into the cul-de-sac region where the drug is released slowly. So there are three different mechanisms by which the drug is released. So the first mechanism is by diffusion. The second mechanism is by osmosis. And the third mechanism is by bioerosion. So by these three mechanisms, any of these mechanisms, the drug can be released in the cul-de-sac region. Once the drug is released, the occusert is removed and it is replaced with a UAV. So as we discussed the definition and mechanism, we have many advantages and disadvantages of ophthalmic occuserts. So coming to the advantage, it has a greater advantage that it is a controlled release or sustained release formulation. It has increased bioavailability, less side effect, less dose required to release, and the patient compliance is good. Coming to the disadvantage, the presence of the ocular inserts or occuserts are felt by the patient. It cannot be administered to pediatrics and pediatric patients. Now coming to the formulation requirements. So there are various formulation requirements which has to be used in ophthalmic occuserts. So the major requirement is antioxidant and the preservatives with the polymers. Other than that, we use buffers, stimulating agents, thickening agents and plasticizers. Now we will be discussing about different methods we employ to prepare ophthalmic occuserts. So there are three different methods by which we prepare ophthalmic occuserts. They are solvent casting method, glass substrate technique and melt extrusion method. So these three methods we will be learning in detail, which are mainly used in preparation of ophthalmic occuserts. Coming to the first method, solvent casting method. So we will be dealing about that in the form of a flowchart. So this is the flowchart of solvent casting method. So the solvent which we are using in solvent casting method are usually volatile solvents like ethanol. So this is a flowchart, we will be discussing it. So what we do here is we take polymer, we weigh it, the required amount of polymer is water and we add solvent to that. Later we mix it together. To that we are adding plasticizer, mix it, and to that we are adding drug till a uniform dispersion is obtained. So once the uniform dispersion is obtained, we pour the content into a petri plate and we invert the funnel on the petri plate. So it will look somehow like this. So if this is the petri plate, this is the content. So we are inverting a funnel. So as I said, we are usually using volatile solvents. So what will happen once we invert the funnel, as we keep it for drying, whatever the volatile content is there, it will start getting evaporated. So once it is getting evaporated, what will happen? Whatever the content is placed within the petri plate, it starts getting dried. So until the whole content is dried, we keep it for drying. Later, once it is dried, we cut it to the required size and shape. So this is the flowchart for your solvent casting method. So the second method which we will be discussing is glass substrate technique. So the method involves, what we do here is we take polymer, here we are adding solvent. So as we know, we are taking high molecular weight polymers. So when we are soaking it for 24 hours, they start swelling in presence of solvent. So once we soak it for 24 hours, we filter it through muslin cloth so that the excess solvent is removed. So to that we are adding drug complexing agent. What we use here is beta-cyclodextrins. So once we add everything, we mix it together. Then we pour it into a glass mold. So after pouring it onto a glass mold, we cut it into the required shape and size after the drying process. So it's a very simple method. The name given glass substrate technique is because of the glass mold we are using in this method. So the third method of preparation is melt extrusion method. The name given is because of the instrument we are using, that is melt extrusion panels. So the procedure is the drug and the polymer both are blended together and we are passing it through the sieve so that whatever the fine particles are there, it will come out and the bigger particle size is reduced and later it is passed through the sieve. So it is collected and to that we are adding plasticizer. Then we are passing all these content into the melt flow apparatus. So as you can see, this is the apparatus. So we have a weight, we have a piston, we have two heated barrels, and we have a capillary through which the extrudate is passing. So what will happen, whatever the content we have prepared, that we are putting it into this apparatus. We are adjusting the required weight. So when we start adjusting the weight, the piston starts moving downwards. So because of these heated barrels, the content is usually semi-solid in nature. It will start moving through the capillaries. So once it starts coming out, that is the extrudate, once it starts coming out, we cut it to the required size and shape. So these are the three different methods which are involved in the preparation of occuserts. Thank you.